Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, we are discussing ESIC previous year questions and answers. Till now we discussed 4 parts. All ESIC previous year exam questions. Surely these questions will helpful for your coming exam. Today's first question, lifespan of fetal RBC is. This question from ESIC question paper 2016. Option we can see first option 80 days, option B 5 to 7 days, option C 120 days, option D 100 days. Lifespan of fetal RBC is the question. So correct answer is option A 80 days. Fetal RBC has shorter lifespan than adult RBC. Okay, adult RBC, the lifespan of RBC is 120 days. Here fetal RBC is 80 days. The next question, lifespan of RBC is. Options, option A 80 days, option B 5 to 7 days, option C 120 days, option D 100 days. Lifespan of RBC. It is 120 days. Option C is the correct answer. Okay, fetal RBC is 80 days. If it is not mentioned and it is like RBC, lifespan of RBC means 120 days. Move on to the next question. Red blood corpuscles, that is RBC, are formed in options. Option A, liver, option B, small intestine, option C, kidney, option D, bone marrow. RBCs are formed in a red bone marrow. Option D is the correct answer, bone marrow. The formation of RBC which occurs in red bone marrow is known as hematopoiesis. Okay. Move on to the next question. Which organ is the primary site of hematopoiesis in the fetus before mid-pregnancy? Options, option A lung, option B liver, option C bone, option D spleen. Question, hematopoiesis in the fetus before mid-pregnancy. Correct answer, it is in liver. Option B is the correct answer. In the embryonic period, the hematopoiesis occurs in the yolk sac. Okay, between 2 months to 6 months it occurs in liver, and 6 months to 9 months it occurs in bone marrow. Our question is mid-pregnancy. Mid-pregnancy is between 2 to 6 months, that is in liver. The next question, microcephaly is diagnosed when the head circumference is less than. Options, option A 3 standard deviation, option B 4 standard deviation, option C 2 standard deviation, and option D 1 standard deviation. Microcephaly is diagnosed when the head circumference is less than 3 standard deviation. Microcephaly means when the baby's head is smaller than expecting. Okay, it is diagnosed when the head circumference is less than 3 standard deviation. Option A is the correct answer. Move on to the next question. What is early onset of neonatal sepsis? Option, infection within 12 hours of birth. Option B, infection within 72 hours of birth. Option C, infection within 24 hours of birth. Option D, infection within 48 hours of birth. Early onset of neonatal sepsis means infection within 72 hours of birth is known as early onset of neonatal sepsis. Usually this neonatal sepsis occurs, that is early onset of neonatal sepsis occurs in intranatal and intrauterine causes. Mostly the nosocomial infection, that is infection which is getting from the hospital. Next question, oral white patches which commonly seen in infants which bleeds on touching is called. Options, option A pancytopenia, option B leukoplakia, option C leukopenia, option D myeloma. Oral white patches seen in infants is known as leukoplakia. Option B is the correct answer. And the next question, length of gastrointestinal tract is. Options: Option A 15 to 20 feet, Option B 20 to 25 feet, Option C 23 to 30 feet, and Option D 30 to 35 feet. Okay, it is in feet. Option is in feet. Length of gastrointestinal tract. Correct answer is option C 23 to 30 feet. Average length of gastrointestinal tract is 7 to 9 meters or 23 to 30 feet. The next question, normal value of CVP, central venous pressure, is options: Option A 2 to 5 centimeter water, Option B 3 to 8 centimeter water, Option C 5 to 10 centimeter water, Option D 7 to 12 centimeter water. Normal CVP is 3 to 8 centimeter of water. Option B is the correct answer. And the increased CVP we can see in case of right-sided heart failure. This is one of the important points. CVP is increased in case of right-sided heart failure. Move on to the next question. Sperm get nutrition from options: Option A fructose, Option B sucrose, Option C glucose, Option D amylase. Sperm get nutrition from option A is the correct answer. It is from fructose. Move on to the next question. Normal CPP, cerebral perfusion pressure, is options: Option A 30 to 40 mmHg, Option B 40 to 60 mmHg, Option C 50 to 70 mmHg, and Option D 100 to 110 mmHg. Correct answer is 50 to 70 mmHg. Option C is the correct answer. Normal cerebral perfusion pressure. Cerebral perfusion pressure means it's a difference between mean arterial pressure minus intracranial pressure. And the next question, normal ICP, intracranial pressure, is option A 5 to 15 mmHg, Option B 3 to 7 mmHg, Option C 10 to 20 mmHg, and Option D 15 to 25 mmHg. Correct answer is option A 5 to 15 mmHg, normal intracranial pressure. Move on to the next question. Physiological jaundice appears in newborn. Option A at birth, Option B within first week of birth, Option C within second weeks of birth, Option D none of this. Physiological jaundice appears in newborn. Correct answer is option B within first week of birth. This physiological jaundice usually occurs within 48 to 72 hours of birth or within first week of delivery. Okay, within first week of birth. In term babies, its maximum intensity we can see on 4th day and usually it subsides by 7th day. But in case of preterm baby, the maximum intensity we can see on 5th to 6th day and it subsides by 14th day. In term baby, it subsides by 7th day. In preterm baby, it subsides by 14th day. The next question, which factor present in the breast milk may cause jaundice in newborn? Options: Option A pregnenolone, Option B galactose, Option C IgA, Option D none of this. The factor which is present in the breast milk can cause jaundice is pregnenolone. Option A is the correct answer. Pregnenolone and beta-glucuronidase which is present in the breast milk may inhibit the excretion of bilirubin which may cause jaundice in newborn. Move on to the next question. How many times baby should pass urine during phototherapy? Options: Option A 7 to 9 times per day, Option B 10 to 12 times per day, Option C 4 to 6 times per day, Option D 1 to 3 times per day. The baby should pass urine 4 to 6 times per day during phototherapy. Option C is the correct answer. Move on to the next question and easy question. How much distance should be maintained from belly light to neonate? Not less than. Options: option A 25 centimeter, option B 35 centimeter, option C 15 centimeter, and option D 45 centimeter. That is the distance between phototherapy light and neonate. That is the question. So correct answer is option D 45 centimeter. Move on to the next question. During phototherapy, the nurse should apply eye patches to the newborn eye too. Options: option A prevent injury to conjunctiva and retina, option B reduce overstimulation from bright light, option C limit excessive rapid eye movement, and option D all of these. Why we are using eye patches to the eye during phototherapy for a newborn? That is the question. It is to prevent injury to conjunctiva and retina. Option A is the correct answer. And the next question, smallest form of vein is called. Options: option A capillaries, option B venules, option C vena cava, option D sinus. This question is from old question paper, that is ESIC exam 2009 question. Correct answer is option B venules. Smallest form of vein is called venules. And the next question, red blood cells are synthesized in the embryonic life in the options: option A yellow bone marrow, option B yolk sac, option C red bone marrow, option D kidney. This question already we discussed. Red blood cells are synthesized in the embryonic life in yolk sac. Option B is the correct answer. During embryonic life, it is synthesized in yolk sac. During 2 to 6 months, hematopoesis occurs in the liver, and 6 months to 9 months it occurs in the bone marrow. So here embryonic life is the question, so it is in yolk sac. Option B is the correct answer. The next question, this is also from old question paper, that is ESI exam 2009. And the question, the largest artery of the human body is option A aorta, option B carotid artery, option C subclavian artery, option D pulmonary artery, and the correct answer is option A aorta.